Hi everyone, welcome to Andrea Saliba Wellness TV, the place to be to get holistic nutrition and wellness tips. Today's a special day because I have Lacey Forsyth here.
Hi.
And she is a registered physiotherapist. And I thought it would be great to bring her in because I've heard so many amazing things about her, about you, in the community here. And she deals mainly with pre and postnatal. So being that I am currently 18 weeks pregnant, I'm so glad that I bumped into your account on Instagram, and ironically a lot of people I knew know you as well and said so many great things about her. So I wanted to reach out, and I thought it would be a good idea to do a video and have her come on and talk about pubic symphysis. Is that right? Did I say it right? Symphysis. Okay, it's almost like a tongue twister for me. So pubic symphysis was something that I experienced in my previous 2 pregnancies with my sons. And it is incredibly painful for anyone who's experienced it. And being 18 weeks pregnant with another boy now, I'm starting to feel mild symptoms of this again coming back. And I really wanted to have you on because I know, just talking to my local community of moms who are currently pregnant or just had a baby, a lot of them aren't aware of even what this is and what to look out for. And when I explain some of the symptoms, they're like, oh, is that what it is? And then I tell them, yeah, like I had this, and it's very painful. For me personally, at the very end of my pregnancy, especially with my 3rd one, I actually was almost unable to walk. Like I couldn't walk up the stairs. It's like a sharp shooting pain in the pubic bone. And I actually had to be put on bed rest, and my doctor ended up inducing me just a couple days early because it was so painful. So I'm gonna put the spotlight on you. Just tell everybody at home maybe a little bit about what it is.
Okay.
And also give us a bit about your background and like what led you to wanna specifically work with pre and postnatal.
Okay. So Andrea, thank you so much for having me on your YouTube channel today. I am a registered physical therapist, which means that we went to school, did a bachelor's degree, and then we followed up with a master's program in physical therapy through the Faculty of Medicine at UBC is where I went to school.
Okay.
I was the only mom actually in my class in the program. So of my cohort of 80, 79 of them were in their mid-20s and young and buff and fit. And I was the only mom, and I very quickly realized through the program that my body was very different than everybody else's. And I struggled through the program with core weakness and instability, chronic SI pain, and some pelvic floor dysfunction. So any sort of higher level lifting or loading activities, I would sometimes leak urine.
Okay.
So I felt a little bit uncomfortable and a little bit awkward with my classmates because I knew that I was a little bit different. And over the course of a few years after graduating, there was quite a few physios that I ran into that suggested I get into women's health and pre and postnatal. And for me, I think learning about it wasn't quite enough. I think I had to just really deal with my own body and my own insecurities and my own challenges and be comfortable with those in order to be able to help women. So I love working with moms. I love working in the community with women, and I like to inspire and empower women to be their best selves.
And that's one reason why I reached out to you, because that's what the whole purpose of me creating this YouTube channel was. You know, I want to inspire women. I want to encourage women to love and appreciate their bodies, but I also want to link and connect with other women in my community that can be very helpful to my viewers and my followers as well. And I thought you fit that so perfectly, because I know a lot of my viewers and followers are moms who either are pregnant, are thinking of becoming pregnant, or have had children. And this is one other point I want to say. Like, I was actually speaking to a lady a couple weeks back, and we were talking about exactly this topic, and she had her baby 3 years ago. And she said to me, oh my gosh, I still feel that when I'm doing a lunge. And I'm like, I know, because even before I got pregnant with this baby, I would be doing oxygen yoga and fitness, which is one of my favorite workouts. And, you know, some of the exercises I would do or perform, you know, I was almost 4 years postpartum after having a baby, and I could still feel the pain very mildly in my pubic bone. And I thought to myself, well, if I were to get pregnant again, I know this is coming back. So explain that to me. Like, I'm 18 weeks now with this baby, and I'm starting to feel, for example, when I'm sitting and then I get up, I just feel a slight sharp pain in the lower pelvic region.
Yeah.
What's happening?
So pubic symphysis dysfunction it happens when the pubic bones start to come apart or start to pull apart. And that can be for a variety of different reasons. One, it can be hormonal changes. So the
good old hormones.
The impact of relaxin in pregnancy actually has a big influence on pubic symphysis pain and dysfunction. Hip instability and hip weakness. So for us, there are a lot of muscles that attach to our pelvic bones. So the thigh muscles, the inner thighs, your glutes, your low back, your core. If there's any sort of muscle imbalances and anything that attaches to the pelvis, it can cause like a pulling or a shearing force on the pelvic bones themselves, which can cause and reproduce that sharp pain. But the sharpness that you're getting in terms of the pubic symphysis pain itself, or a lot of women in the community call it lightning crotch.
Yeah, I was just gonna say, it feels like a lightning bolt.
Yeah, it's like
exactly
a lightning bolt.
That's exactly what it was. Funny story, if I just may say, because I remember when I was pregnant with my second, he was a big baby. And I remember like towards the end of the pregnancy, I was just walking in the mall, and all of a sudden I stopped in the middle of my tracks, and I was like, oh my God, I can't move. Like, I can't walk, I can't move. So I quickly pulled my phone out because I have a good relationship with my doctor. And I texted him, and I'm like, I'm in the middle of the mall and I physically cannot move. What the heck is going on? And I explained to him, like, it was like I was frozen. Yeah. I was scared to take the next leg forward. Yeah. And he's like, oh, he explained what it was. And I was like, oh my gosh, what do I do? So I literally just froze, and I waited a few minutes. And then it was kind of, I felt like the Tin Man. Like I was stuck. I needed someone to like kind of re-push me again. But it can be very scary if you're unaware what that is. If it's your first pregnancy, or, you know, even for me, it was my second. I had no idea like what that was. So I'm glad we're doing a video like this to educate people.
The reason why you probably experienced it in the mall, at least, or with some activities like walking, climbing stairs are usually the big one.
Yes.
Any sort of movements that cause a shearing or a rubbing force on the pubic symphysis itself, which is a fibrocartilage disc that exists in between the front of the two pubic bones, and it acts as a shock absorber, but it gets inflamed with pubic symphysis. And so anything that causes it to rub this way, or when you're going up and down stairs, it's just really a lot of rubbing. So usually some advice that I give to moms who are experiencing pubic symphysis pain is to keep your movements symmetrical. So try and avoid an asymmetrical movement through the hips as much as possible.
So you mean running up and down the stairs is a bad idea?
Yeah, it's not the best.
I was like trying to chase the kids up. No wonder it hurts.
Yeah, if you have to do that, actually try walking up the stairs sideways.
Oh, okay.
It decreases the pressure on the pubic bone itself, and you get a little glute med workout at the same time. So it helps.
I think near the end of one of my pregnancies, I forgot it was with the second or the third, I remember going up on my knees. Like I was like probably like 40 weeks, like I was due. Yeah. And I would it was so bad that I like would crawl up the stairs, and my husband would be like, what the heck are you doing? I'm like, it hurts so bad. Like, don't even ask. Like, yeah, it was pretty bad. I even wore a belt. So does that help? Like those stability belts? I wore it with my third. I personally didn't find it to be that great, but what do you think?
It's not something that I advocate for if someone's coming to me with pubic symphysis dysfunction. So if someone comes to me in clinic for pubic symphysis pain, we put them through a whole bunch of orthopedic tests to kind of see what joints are more affected than others. And lately, the research has started grouping pubic symphysis pain and dysfunction in with a broader term called pelvic girdle pain in general.
I've heard that, yeah.
So for us, at least for me personally, I like to isolate pubic symphysis from pelvic girdle, just because I like to know if the joints at the back of the pelvis are affected or the joints at the front of the pelvis are affected.
Okay. So say if I came to your clinic, or someone with the similar symptoms or feelings, what would be the first thing you would do to analyze it? Like, how do you...
So first thing I would do is sit down and chat with you and get what we call your subjective history. So kind of understand, when did the pain start? How did it start? What are the movements that bother it? What makes it feel better? And kind of just your medical history in general, as well as your obstetric history. And then some of the movements that we commonly test are a squat, a lunge, We have what we call in physio special tests or orthopedic tests. And so a couple of the ones that we use for pubic symphysis pain in general is just a palpation test. So we will touch the pubic symphysis to see if it's really sore. We use a stork test as well, and well as compression and distraction of the hip bones.
Awesome.
Yeah.
I'm so excited that she just opened a clinic in Port Moody.
Yeah.
And I'm so happy to hear about that, because there is, of course, other physiotherapists around, but I just think it's so great that you're specifically dealing with pre and postnatal. And I think postnatal is equally as important, because I think a lot of women think, oh, okay, baby's born, things are going to be good, but our pelvic floor takes a huge hit when you give birth.
Yeah.
Like whether you've had cesarean, correct me if I'm wrong,
Absolutely.
or vaginal delivery, it's either way, like your pelvic floor does take a big hit. And we were going to just brush lightly on the incontinence.
Yeah.
Because I think that's something people don't want to talk about because they feel embarrassed, but the reality of matter is that it's a real thing.
Yeah.
And it can happen during pregnancy.
Yeah.
And after. So talk just a little bit about that. Like, what do we do to strengthen is it called the PC muscles? Or the
pelvic floor?
Yeah, the pelvic floor muscles. What do you call those, the actual muscles? Is it just called pelvic floor?
We group it in pelvic floor. There's 11 actually, in terms of the pelvic floor unit itself. So just to kind of debunk a little bit of a myth around incontinence itself, there's two main reasons why women are incontinent, either prenatally or in the postpartum period. One is because their muscles definitely are weak, and then in that case, strengthening would be indicated. The other reason is the muscles are too tight. So when a woman,
I didn't know that.
Yeah, when a woman delivers a baby, whether it's a cesarean birth or a vaginal delivery, your body can sometimes perceive it as a traumatic experience. Those muscles actually lengthen between 200 and 250% in a vaginal delivery.
Wow.
Which, if you went for a run and pulled your hamstring and it stretched that much, it would be a big change to that hamstring muscle.
Wow.
So your body, if you don't take care of your pelvic floor, either prenatally or postpartum or both, your muscles are going to try and tighten and guard and protect themselves because they don't want that lengthening to happen again. Does that make sense?
Yes, totally, yes.
So, and even with a cesarean, the cutting or like the scar and the incisions itself affect your pelvic floor because they affect your deep core muscles. So all of that kind of leads into some pelvic dysfunction. Between 75 and 80% of women who have had a vaginal delivery have some degree of incontinence at some point in their life, and 50% of women who have had a cesarean are incontinent at some point.
So is this where we do our Kegels? Is that?
Our Kegels and our reverse Kegels. So that's where the pelvic floor assessment would really come into play to understand are your muscles truly weak, or are your muscles too tight and hypertonic, and do we need to relax them before we strengthen them? Sometimes we can address women's incontinence by just teaching them how to relax their pelvic floor muscles as opposed to the strengthening. They might be really strong, but if their muscles are clenched, they can't recruit them and access them.
So does that also, if your muscles are really tight down there, does that mean when you go to have your vaginal delivery, does that hold your baby back sometimes?
Sometimes, and it can lead to increased risk of tearing, painful intercourse.
Okay,
Yeah.
See, I didn't know all
Hip
this.
pain, back pain, all those fun stuff.
Okay, this is so good to know, because we always think like the muscles would be looser, being that there's so much pressure, but we don't actually think that the muscles can be actually too tight as well.
Yeah, and that's, most people will come in and be like, I've been doing my Kegels, and
It's like you're doing the wrong thing.
You're doing the wrong thing, do the opposite.
Yeah.
You need to learn how to relax your pelvic floor.
Okay.
And I would say clinically I find about 70% of women, their pelvic floor muscles are too tight as opposed to too loose.
Interesting.
Yeah.
Okay, and what makes them too tight? Like exercise or
Exercise,
just in general?
stress. There's a big link in the research in terms of pelvic floor health in women's stress and women who are anxious and stressed.
Interesting, because I do remember with like a bit personal, but I do remember with my first, actually all my babies, my doctor used to always tell me, quit exercising so much, like near the end, because he's like, your muscles are so tight. He's like, the baby's literally like being sucked in. And I'm like, well, I don't know how to relax them. That's just how they are. So that's so interesting to hear that, because I would have thought the opposite, especially for my body with having the pubic symphysis. I would have thought the opposite, that they're getting looser because of all the pressure, but that's not necessarily the case, you're saying.
Not with the pelvic floor, with incontinence, yes.
Oh, with incontinence, okay.
With pubic symphysis, it's often the movements that irritate the pubic symphysis itself, and then a set of muscle imbalances. So you might have some muscles that are really loose, and then you might have some muscles that are really tight.
So it doesn't, did we already ask this? I don't know, I can't remember, but it doesn't matter on the size of your baby. If you've got a big baby pressing on the pubic bone.
It wouldn't cause pubic symphysis dysfunction to occur, but it would definitely cause increased pressure on it, which could make it a little bit more painful, which is why typically women start to experience symptoms in the second trimester when relaxin starts to kick in, and then it kind of gets worse as the pregnancy progresses because you've got increased fluid, increased blood volume, the hormones are in high gear, and just the baby's getting bigger, so it's just more pressure on that pubic bone, which is why certain exercises are important in order to create muscle balances and pelvic stability.
Good to know.
Yeah.
Well, I'm definitely coming into your clinic like ASAP. I can't wait. And you have just a couple exercises for me to just demonstrate to the people at home that we can strengthen. Is it the pubic bone or the surrounding muscles?
The surrounding muscles. Okay. Itself,
So we're gonna get into that right now, and Lacey's gonna demonstrate using straight.
I just need a couple of pillows to prop you up, so that
we'll use these pillows then.
Yeah. Just because when you're in the second trimester, I don't really want you lying flat on your back.
So let's talk about that though, because that's also a really good point. So first trimester, you could still lay on your back.
Yeah.
Second, third, we want to elevate the body versus.
We want to elevate the body. So lying flat on the back, it's not. A lot of women come into the clinic and say, I wake up every morning and I'm flat on my back. Is that bad for my baby?
That happens to me all the time.
And I'm like, well, you should try and lay on your left side specifically because it increases blood flow and perfusion to the placenta and to the baby. And when you're lying on your back, the weight of the baby as it gets bigger can compress the placenta, which is kind of what
I do remember that in my first, with my first. And by the time second and third came, I'm like, well, there's nothing I can do to control it. But I remember waking up in the middle of the night like, oh, I'm on my back.
Yeah.
It's my poor baby. And she turned out okay.
Yeah, it's fine. It's fine. If honestly, if there was something wrong, your body would...
It would wake you up. I totally agree with that. Okay, so I'm gonna lay...
You're gonna lay down on your back with your head on the pillows there, just to get you at about a 30-degree incline.
Sorry, I just wanna make sure I'm in the camera here too. All right, so is this right?
That's perfect.
Okay.
So just a couple of exercises that we often use for mamas when they come in with pubic symphysis pain. We want to gently load the hips and gently load the pelvis. We don't want to release anymore. So a lot of people say, oh, I've got pubic symphysis pain and hip pain, and I go for these massages, and they're saying that my glutes are really tight and that I need to keep releasing my muscles. If you think logically about it, you have the impact of the hormones and of the ligament laxity, and that's what's causing that distraction pain and distraction discomfort. You don't want to continue to release any muscles around the pelvis. You want to add a little bit of gentle strength into those muscles to alleviate them or the impact of the hormonal laxity.
All right.
So the first exercise I always like to give is what we call an isometric movement or an isometric hip stability exercise. So what I'm going to do is I'm just going to take a soccer ball, and you can use any sort of ball from the dollar store. It doesn't have to be just something about this size. And you're going to gently place it in between your knees. And with about 30 to 50% tension or activation, I'm just going to get you to gently squeeze the ball and hold it for 5 seconds. 4, 5, good, and then just relax the tension.
You can feel my thighs twitching as I worked out.
And again, squeeze for 5, 4, 3, 2, 1, good, and let go. So you're going to repeat this movement 10 times.
Okay, I can do this. I can do this while I watch TV at nighttime.
Yeah, it's really simple. Not a lot of equipment, just a small ball.
I wonder if Nicholas will be okay sharing his soccer ball with me.
I'm sure it'll be fun if you need it for like 30 seconds.
There we go. Okay, and then what would be the next one?
The next one, we do the opposite movement. So sometimes moms will need a partner for this exercise, or you can just do one side at a time up against a wall. But what I'll get you to do is to bring your knees hip width apart. Perfect, feet flat on the floor. And I'm gonna get you to gently press out into my hands. A little bit less tension there.
I recall doing this with my third. I don't remember where I used to go, but I
gently press out. Hold for 5, 4, 3, 2, 1, and let go. So you repeat that one 10 times.
Okay.
Okay? And then I like to bring the glutes and the abs in just to create a little bit of front and back stability, because these ones do the side stability of the hips.
Okay.
Does that make sense?
Yeah. Mm-hmm.
Okay. So sometimes moms can't do a full bridge because it's too painful on their hips or their low back. So I usually just assess with a Kegel and a pelvic tilt. And then if that's okay, we will progress into a full bridge.
Do you want me to try a full bridge first? I think I feel okay for it.
Okay, so try a full bridge first.
Like that?
Yeah, and then down. Any pain?
None at all. No.
Okay, so perfect. And coming down. The trick with this is to get the whole pelvis working and the whole pelvis firing. So what I'm actually going to get you to do is what we call a Kegel bridge.
Okay.
And what that is it's integrating the pelvic floor muscles or the Kegel muscles on the inside of the hip bones with the glute muscles on the outside of the hip bones.
So what's the best way to describe for people at home a Kegel? Is it wrong to say act as though you're holding your pee in?
It's a cue that is commonly known. It's not my favorite because then people sometimes associate holding their pee with pelvic contractions, and you actually want to relax your pelvic floor muscles when you're going.
What's a good way for me? How can I?
So a couple of my favorites are one, gently picking up a blueberry and putting it back down with your vagina. The second one is drinking a triple thick chocolate milkshake through a straw up with the vaginal muscles.
Okay.
And then the third one is a jellyfish. So if you want to think about the jellyfish swimming up underneath your belly button.
I'll go with the blueberry.
The blueberry. Okay. So how this works is you want to take your nice big diaphragmatic breath or nice big belly breath in. Good. As you exhale, I'm going to get you to gently pick up that blueberry. Good. Now squeeze your glutes together, lifting your hips up off into the bridge, and then lowering down. And then relax everything.
Okay.
So nice big belly breath in again.
This takes a lot of mental focus.
It does. There's a lot going on. As you exhale, pick up your blueberry, squeeze your glutes, lifting up, and then lowering down. So you want to do 10 of those as well.
I find it challenging to do picking up the blueberry at the same time. It's like my brain can't comprehend it, but I'm going to try again.
Just like that.
So are you suggesting people at home to do all 3 of these exercises in one day?
Yeah. So I would start with the ball between the knees, then the outside resistance, and then following up with 10 glute bridges with the Kegels in between.
And
it's a good gentle way to start with pubic symphysis pain.
Okay. And how many times a week would you suggest?
5 times a week. I'm not a physio who says exercises need to be done every day. I like them having a couple of days off as rest because the muscle fibers do need time to recover.
Especially, so for someone like myself who's very, very active, like I do work out still about 4 to 5 days a week right now. Depends on my body. If I'm tired, then I don't. Is it okay to incorporate this on the same days that I'm doing my workouts, or is it better to do it on maybe the days where I rest, or what do you suggest?
I would actually, because this is the area that you're having discomfort with and pain, I would actually start your workout program with these exercises so that it puts your body in a better position to do some of the higher level exercises that you enjoy doing.
That makes sense.
It almost primes it.
That totally makes sense. Okay. Well, why don't you tell everybody at home where your clinic is located, where they can find you on social media. Maybe there's some people watching that aren't locally, but they might want to follow you and some of your tips, because she's got a really great page, so go ahead and let them know.
So if you live in local Tri-Cities area, you can find me at Bump Physio & Co. We're located at 88 Kyle Street in Port Moody. Our website is www.bumpphysioco.ca. You can find me on my social media pages at Lacey Forsyth PT or at Bump Physio on Instagram and Facebook.
Yay, thank you so much for being here today. I feel like Lacey really got a lot of key points, and I definitely learned a lot, and I'm sure everybody at home did as well. So I really thank you so much for being here today. And thank you all for watching. Don't forget to subscribe, give this video a great big thumbs up, and don't forget to follow Lacey and myself on Instagram. I'm Andrea_Saliba.nutrition. Have a wonderful day. Take care.
Thanks.